this is Dr. Joe Borio with what used to be our health kick. I stopped doing a health kick because I started pulling my hamstring. No, I'm kidding, but we're going to title it Change Your Health, Change Your Life. And I think that's really what we're striving for. And what you'll notice is every week or every couple of weeks, I'm going to come to you for 4 or 5 minutes, and we're going to talk about different research, different things you can do on a day-to-day basis to change your health, which in turn will change your life in every aspect. Your level of energy, your interaction with other people, your social community, your productivity, your attitude amongst yourself, other people, work, your level of success, both I think socially and financially, in every aspect. So you'll find that people that are healthier have all of those other aspects certainly improved or have the potential of improving them. So today I wanted to bring you a really interesting study. It's certainly not surprising to me, but it may be surprising to you, and that is there's a link between allergies and cancer. And I've read this for many years. I've certainly, if you read a lot of the Eastern views of health and body, what they'll call physiology and how the body works, you'll see that if the body has more allergies, you'll see a significant increase in those people later in life developing cancer. They're at a much higher risk. In fact, this 92 study, now this was done in 1992, was in the American Journal of Epidemiology. Okay, so studying essentially statistics, studying numbers or statistics involving diseases. So, okay, so that's what epidemiology is going to mean. So allergies and cancer are connected. They did 34,000 Seventh-day Adventists had suggested throughout the study, and the connection was very, very straightforward. Okay, so basically what it stated was that there was an increase in if you had an increase in the number of allergies, you had an increase in the likelihood of developing cancer. Now they didn't evaluate all cancers. They did evaluate a couple cancers. One was one was breast cancer. I apologize. One was breast cancer. Breast cancer had a significant increase with increasing number of allergies. And among males, and that was the female study, obviously, numbers, among males in the study, reaction to medications was associated with a 33% risk of all cancers, while females experienced a 21% risk associated with cancer. So what they were also showing is that in evaluating, or if the people had the allergy, is it just the allergy, or those people taking medications for their allergies, was it the medication that increased? So they saw an increase in both. If you didn't take any of the medication and you had allergies, you had an increased likelihood of developing cancer. If you had taken medications, if you had allergies and took medications, you had an additional increase in the likelihood of developing cancer. So, I mean, you know, when we look at this, we have to understand that when we look at cancer is really a breakdown of the immune system. And why I say that is everyone, as much as this may have kind of freak you out, but everybody has cancer cells. We make about 1,000 to 10,000 cancer cells a day, but we all don't develop tumors. Your immune system, very complicated system, extremely important system, is constantly fighting off invasions to the body, viruses, bacteria, yeast, and different types of funguses, and everything, and different types of cells, obviously, that are in the body that are sick of disease. Those will include cancer cells. So when the system gets weak, or when you're developing sickness faster than you're developing health, you're developing sickness faster than health, your body often will get sick, and in this case, it'll develop cancer. So people that have allergies have a problem with their immune system. An allergy is essentially a problem with their immune system. There's a lot of different reasons why you can get allergies, guys. But knowing this, if we get invaded with different things, pollen, for example, or different foods, or dander, or other things, proteins and so forth that enter our body, your immune system reacts to them. You'll find that those people have a malfunction, hyperactivity, an overreactive immune system to certain things, and often an underreactive immune system to other things, those possibly in cancer cells. We also see that the drugs that are used to treat allergies suppress many times the immune system. Why? That's how they work. They suppress the sensitivity of the immune system, so you're less sensitive to the pollen, but at the same time, the cells in the body that fight off infection and kill cancer cells, they too become desensitized. Therefore, you're getting sicker faster than you're getting healthier. And it's scary because our society, our paradigm, when you're brought up from a little kid up, our paradigm is that, there's a pill for every ill. And, to say that medicine never has a place is foolish. But to say that medicine always has a place, or that medicine is always the first place to look for, that's foolish too. And unfortunately, that is our society. So we need to start looking differently. We need to address that problem differently than we're addressing it now. And that problem goes away. Another interesting story, I'll say quickly, but there was a study on baby aspirin. You see all these people taking baby aspirin. Same thing. That actually shuts down or decreases the effectiveness, the productivity, the proficiency of the immune system, and we see an increase in cancer, one of them being pancreatic cancer. So you see all these people taking baby aspirin, there's actually a significant increase in the number of people developing pancreatic cancer directly from taking baby aspirin. So, it starts to question, do I want to die from a heart attack, or do I want to die from cancer? And then all of a sudden I hear people say to me, well, you got to die from something. Well, I agree with that, but let's die from something in old age. Let's not die from something when we're starting to see 30, 40, 50-year-olds get pancreatic cancer at a much increased rate. When we start to see that our children of today are not going to outlive the number of years that their parents lived. I mean, there's something wrong here. When prescription drugs, that doesn't include over-the-counter and even medical errors. When non-error prescription drugs kill so many people that it becomes the third leading cause of death in the United States, we got to start stepping back and going, wait a minute, that system isn't the right system. We have to look for a system that keeps us healthy rather than becomes involved or reactive when we're already sick. And that's where healthcare practitioners come in. We're the people that say, in a sense, brush your teeth, right? We're saying, use that same logic, that same mentality when it comes to the health of your body so it doesn't get sick, rather than waiting till it gets sick before you react. Because you got to remember something, and I'll end it here, but you're already sick for a long time before you get sick. Heart disease doesn't start at 40, 50, 60 years old when you have the heart attack. It started 20 or 30 years earlier. And I don't care if it's back pain or allergies or joint pain or visceral problems or disease internally in your body, whether it's your appendix or your pancreas or your large intestine or whatever it is. That was sick a long time before you ever said ouch. And it could be 40 to 70 or plus% sick before you even say ouch. So you're really sick by the time you start having problems, before you start noticing that your body is sick. Know that when you start to notice it, it was sick probably a decade or two prior to you ever saying ouch. Really important to recognize that. Remember, guys, tune in every week or two. It is what? Change your health, change your life. Remember to eat well, to exercise, get a good night's sleep, drink plenty of water. Think good thoughts up here, man. I'll tell you, change your brain, change your life as well. What's going on up here changes your whole body. And remember, guys, you and your mother and your father, your grandfather, your uncle, your cousin, your nephew, and people all over the planet, people you haven't even met yet, tell them about Chiropractic. Keep the spine healthy so those good signals and messages from the brain can get to the body and back up and keep you and everyone that you know in your community as healthy as they should be. This is awesome. I'm so glad I got a chance to spend a few minutes with you today, and I look forward to talking to you next week, guys.